Teacher Channel, and welcome to this presentation, my first aid quiz series, my first aid quiz series. So this presentation will kick off a number of series to come, focusing on first aid knowledge test. So this will be the first edition. Let's see the objectives. Number 1, to help you evaluate your knowledge of first aid. Number 2, to help you prepare for the first aid training. Number 3, to help you prepare for first aid exams. Number 4, to help you build your confidence in the first aid course. So those are the 4 objectives of this presentation. Instruction: please indicate your answers on a piece of paper. There will be 25 questions. Please write your answers on a piece of paper. And then at the end of the day, at the end of this presentation, answers will be provided, and then you're going to use it to grade yourself. Please share your comment below. You can also like and share the video and subscribe if this is your first time of visiting the channel, or if you have not subscribed already, you can also turn your notification bell on. Please. Thank you. Sample question. So let's see the sample question. The laws that protect first aid providers are called: A. First aid and CPR laws. B. Acts of kindness laws. C. Good Samaritan laws. D. Standard first aid protective laws. So the answer is C. The correct answer is C. Good Samaritan laws. Please answer the following questions. Just as was said before, write your answers on a piece of paper, and you will grade yourself later. So time starts. Question 1. What are some of the objectives of first aid? What are some of the objectives of first aid? A. Rushing to rescue a person from a burning house. B. Preserve the life of an ill or injured person. C. Prevent further injuries from occurring. D. All the above. E, B, and C only. So write your answer, the one that you think is correct, only one, of course. Write it on a piece of paper as we move to question number 2. To be protected by the Good Samaritan laws, the first aid provider must: A. Use reasonable skills. B. Stay within the first aid scope. C. Obtain consent or permission. D. All the above. E. Only B and C. To be protected by the Good Samaritan laws, the first aid provider must. So what must you do to be protected by the Good Samaritan laws? So make your choice. Write it down, please, and let's go to question 3. Question 3. Which of these is true? Which of these is true? A. 911 must be called every time first aid is provided. B. Hazards can cause harm or death. C. First aid skills are required for employment purposes only. D. Provide first aid regardless of your safety. Choose one of them, write it down, and then get ready for question 4. Question 4. It is unethical to assume that every patient is potentially infectious. It is unethical to assume that every patient is potentially infectious. A, true. B, false. Which one is correct? Is it true? Is it false? Answer and then get ready for question 5. Question 5. What is emergency scene management? ESM. What is emergency scene management? ESM. A. All the first aid activities provided to lessen the impact of emergency. B. Washing the wound with a chemical solution. C. Giving sugar to a hyperglycemic patient to increase the blood sugar level. D. All the above. Question 6 is coming. I'm sure you have put your answer down on a piece of paper. Question 6. Emergency scene management comprises of A. 2 sequences, B. 4 sequences, C. 5 sequences, D. More than 5 sequences. Emergency scene management comprises of how many sequences? So please make your choice, write it down, and then question 7 is on the way. Question 7. The emergency scene management sequence where safety is one of the main concerns is called A. Ongoing patient care, B. Primary survey, C. Secondary survey, D. Environmental survey. A. Ongoing patient care, B. Primary survey, C. Scene survey, D. Environmental survey. Which option matches the above question? And number 8 is here. How many broad categories of consent does a first aid provider have? How many broad categories of consents does a first aid provider have? A. 2, B. 3, C. 4, D. 5. Question 9 is coming. Question 9. The victim is unconscious. What type of consent should the first aid provider use? So what type of consent is used when a victim is unconscious? A. Non-verbal consent, B. Verbal consent, C. Implied consent, D. General consent. Question 10. When is it advisable for the first aid providers to wear gloves? When is it advisable for the first aid providers to wear gloves? A. When caring for a victim who is bleeding. B. When caring for a seizure victim who is foaming. C. When caring for a victim who vomits. D. All the above. E. A and C only. What is your answer to that question, and then get ready for question 11. Question 11 is here. Since survey activities do not include A, assessing the RABC of the patient, B, checking for safety, C, taking necessary protective measures, D, obtaining permissions or consents. What is your answer as we move to question 12? Question 12. The ESM, emergency scene management sequence, in which a patient is rapidly assessed for life-threatening condition, is A, secondary survey, B, primary survey, C, ongoing patient care, D, none of the above. Question 13 is coming. Please make your choice to question 12 as question 13 is next. Question 13. Severe bleeding or blood loss can lead to A, shock, B, deep frostbite, C, heart attack, D, anaphylactic shock. Severe bleeding or severe blood loss can lead to which of those options? Please make your choice, and then we move to question 14. Effective communication during first aid involves A, using complex terms, B, using simple terms, C, being polite and listening non-judgmentally, D, all the above, E, B, and C. Question 15 is coming. When is CPR and an automated external defibrillator AED recommended? When is CPR and AED recommended? A victim is unresponsive but breathing abnormally. B, a victim is unresponsive and not breathing. C, a victim is responsive but breathing abnormally. D, a heart attack victim. So when do you perform CPR and when do you use AED? Both of them could be used together. Who do you use it for? Please make your choice, write it down, and then question 16. One of the main differences between arteries and veins is A, most arteries carry oxygenated blood away from the heart. B, most arteries return oxygen-poor blood to the heart. C, blood in arteries are dull red due to rich oxygen. D, none of the above. I believe you have made your choice. You have written it down and then getting ready for question 17, which is next. 17. Provide first aid in whatever position a patient is initially found. Provide first aid in whatever position a patient is initially found. A, I agree. B, I disagree. C, it depends. What do you think is the answer to that statement made above. Write your answer down, please, and then get ready for question 18. Question 18. In the context of first aid, what does RICE mean? In the context of first aid, what does RICE mean? A. Rest, ice, compression, elevation. B. Rest, immobilization, cold, elevation. C. Responsiveness, immobilization, cold, elevation. D. Rest, immobilization, compression, elevation. Question 19 is the next. Write your answer and then we move to 19. What position is recommended for an unconscious breathing victim? What position is recommended for an unconscious breathing patient? A. Supine position. B. Tripod position. C. Recovery position. D. Semi-sitting position. Question 20 is next. A friend of yours is having an asthma attack. What position would you suggest? A friend of yours is having an asthma attack. What position would you suggest? A. Recovery position. B. Tripod position. C. Semi-sitting position. D. Prone position. Question 21. A colleague has mistakenly swallowed a toxic liquid. What should you do to help him? A colleague has mistakenly swallowed a toxic liquid. What should you do to help him? A. Put him in recovery position. B. Induce or help him to vomit. C. Offer him something to drink to neutralize the liquid. D. None of the above. Question 22. What is a heat stroke? What is a heat stroke? A. When a victim can still sweat, but temperature rises. B. When sweating stops and temperature rises dangerously. C. When a person faints due to dehydration. All the above. That's option D. Question 23 is coming. Question 23. A victim is actively nose bleeding. Which statement is correct? So a victim is having nosebleed. Choose the statement below that is correct. A. Apply direct pressure by pinching his nostrils and ask him to lift his head up. B. Apply direct pressure by pinching the bridge of his nose and ask him to lean forward. C. Apply direct pressure by pinching his nostrils and ask him to lean forward. D. Apply direct pressure by pinching the bridge of his nose and ask him to lift his head up. Which statement is correct regarding nose bleeding victim? The care you provide, or part of the care you provide. Question 24 is coming. Here it is. A 3-month-old girl is experiencing a high fever. Which statements are correct? A. Give her a sponge bath with cold water. B. Give her a sponge bath with lukewarm water. C. You may administer doctor-recommended medication to her if you have the necessary authorization. D, B, and C. E, A, and C. Now we're going to the last question, which is 25, and that is just a second away, and here it is. The FAST acronym is associated with the stroke. What does it stand for? The FAST acronym is associated with the stroke. What does it stand for? A. First dropping, hand weakness, speech, and time to call 911. B. Face drooping, hand weakness, speech difficulty, time to call 911. C. Face twisting, arm drifting, speech difficulty, time to call 911. D. None of the above. So this is the last question. Please make sure you are writing your answers. If you need to go back, please do that. Maybe you missed one or two, or you need to check or recheck. Please do that before we review our answer, because the answer keys will be reviewed next slide, so that you match what you have for your paper and then with what we are presenting, about to present now. So the answer keys. So these are the answer keys. Number 1 is E, number 2 D, number 3 B, number 4 is B, number 5 A, 6 is B, 7 C, 8 A, 9 C, 10 is D, 11 A, 12 B, 13 A, 14 E, 15 B, 16 A, 17 C, 18 B, 19 C, 20 B, 21 D, 22 B, 23 B, 24 D, and then 25 is B. So count the number that you got correct, and then over 25, then times 100 to give you the percentage. And please share your score. How many did you get right? Put it on the comment section below, please. And if you enjoy it, why not put your comment? Tell others how enjoyable, how insightful, how educative it is to you. Okay. So thank you for watching. You can always send us email at theteacherchannel@gmail.com. Follow us on Facebook, The Teacher Channel. You can also follow us on X or Twitter, formerly called @FirstAidCPR2. Again, please like if you have not, put your comment, share this to your colleague and other people, and subscribe if you have not done so. You can also turn your notification bell on. So again, thank you so much. Appreciate your time. I am sure you enjoyed it. And then the second edition will be uploaded shortly. So please check again soon. Thank you, and see you next time. Bye bye for now.